Welcome back to PA Live. Luzerne, Wyoming County's Mental Health and Developmental Services oversee all the mental health and developmental services in both counties. Basically, they provide funding to providers to provide and oversee those services.
Yeah, Families United Network is a private nonprofit that gets funding to provide peer services. And with May being Mental Health Awareness Month, Ron Simon, CEO at Family United Network, and Bobbi Jean Bair, Family Peer Support Director at Family United Network, joins us today in this paid piece to further remind us the care of our county citizens with mental disabilities is a community responsibility.
Yeah.
So I am so happy that you both are here today.
Yeah, it's going to be great to get your perspectives. Thank you for joining us. I want to start by honing in on the affiliation with Luzerne, Wyoming County's MHDS. Where does that come in, and how does working together work exactly?
I've been working with Luzerne County MHDS as the lead family coordinator. I've been doing that position for probably about 3 or 4 years now, so I work closely with them.
Yeah. It's important work, and I think it just goes to show that there are a lot of resources in our communities that when they work together, we can help even more people, provide even more services to the people who need it.
So then with Family United Network, in terms of the support that people are getting from them, like what does that actually look like?
Okay, so we're fortunate enough that we get some funding from the counties to provide the important services. So the one thing is there's a lot of coordination that happens, not only with the leaders at the counties, but also with all the other providers to make sure that we're offering a unified service that meets standards that's set both by the federal and our state government, and then definitely on our county levels. But what we basically try to do is make sure we're offering quality care to really meet the needs of our residents that are living in this area.
Can you give like a few examples so we can like kind of conceptualize, you know, like maybe some of the folks that maybe we're our friends and family, but we maybe don't realize that they're getting services from you?
I'll start, and then Bobbi's the expert more so than me. But what we particularly provide is peer services. And there's a lot of research that's been done the last few years that shows that somebody that has walked the same steps, getting that type of help is so powerful, that shared life experience. And that's Bobbi's a leader and an expert in the peer services, so that's particularly what we provide, and I think it's some of the most beneficial help. So I'll let Bobbi talk more about peer work.
Peer work? There's different peers that the county has implemented. We have there's certified recovery specialists, which help with drug and alcohol. There's certified peer supports, which have their own lived experience in the mental health field, and they just use their expertise to be able to help someone that may be struggling with different things that they've struggled with. And there's the family peer supports. We help families that have children in the mental health system that maybe need someone to talk to who understands. You may also need like navigation, like, okay, well this place offers this service, this may be able to help you.
Is there feels so overwhelming?
A scale of like how extreme or not extreme?
Well, that's
like
what I was going to say too. I think that's like a misnomer sometimes, that this is only for like extreme cases, and I think that a lot of the work you do is not so extreme. It's kind of just maintenance. And talk to us about maybe the misconceptions that surround that, if you think they still exist.
Yeah, and I'll add to that because that's a great point. Part of the reason why we have these awareness months, and May being Mental Health Awareness Month, is that there's been so many stigmas, and that a lot of people say, well, I don't really qualify for the help. But you know, we use the same examples today because it really is, it's our overall health. We use the analogy to physical health, that if no problem is small, because a small problem left unattended could become a very big problem. So yeah, people should never think like, oh, I don't really need the help.
That's not for me, right?
Yeah.
It's for everyone. Like, I think mental health is something everybody can benefit from, especially when you guys have access to all of the resources that we could ever want, we could ever need. And I think that peer-to-peer element is so key. And I think that's something that the light bulb might be going off for someone right now that said, I didn't even know that's an option for me. I thought it was like the super clinical, maybe different kind of a feel to whatever service you need. Yeah.
So of course you can continue this conversation. All you see right there on your screen, we have the websites, the phone numbers, connect on social media, maybe share it with a friend or a family member who you think may be able to use it, or maybe just snap a photo of the screen right now and think, maybe one day I may need it, you know, I don't know. But Ron and Bobbi, we so appreciate you joining us today.
Thank you for having me.
Yes, thank you.
And of course, we want to thank Loser and Wyoming County's MHDS for providing this sponsored segment. PAlive continues right after the break. Stay with us.